Hello, my dear students. I'm Dr. Vaishaly Bharambe. I've been teaching anatomy for the last 25 years and I love it. My aim is always to ensure that whenever I teach you a topic, you learn it, you understand it, and you recall it. Let's see if I can do that today with the topic of femoral artery. So, please keep a packet of color pencils and drawing sheets ready with you when I'm teaching. Okay, so when I ask you to draw, please do draw. And secondly, if possible, keep some bones ready with you for reference whenever required. Let's begin this topic by solving a very simple MCQ. The following is true about femoral artery and some details are given. I'm sure you will be able to solve this, or you might be able to, but ending in a little bit of unsure state. There are some other questions such as is it possible to feel pulsations of femoral artery? Can you demonstrate? Name the procedure for which femoral artery is used for cannulation, and so on. To understand all this, students, we must study. So let's study. Right. So my question is, what is femoral artery? Answer is, it's a large artery found in femoral triangle supplying the lower limb. You knew it, I know it. It's a continuation of external iliac artery. Ma'am, you must be thinking, she has put up a diagram there which does not even have the femoral artery in it. What is the point in putting up thorax when we are talking about femoral artery? There is a point, my dear students. Remember, whenever you're talking about any artery, you must be able to trace the artery back to the heart. Whether it is upper limb, whether it is head, neck, whether it is leg. You must be able to trace the artery back to the heart. That is the only way you should study blood supply. So, when the heart contracts, blood is pumped into the aorta. Now look at the image. From the aorta, blood descends down through the thoracic aorta, abdominal aorta, and finally divides into two common iliac arteries. Each common iliac divides into internal iliac, which supplies the pelvis, and external iliac that passes beneath the inguinal ligament to enter into the femoral triangle as the femoral artery. Got it? So that's how you must trace it down. Now let's take a look. Here is our external iliac passing deep to inguinal ligament, entering into femoral triangle as the femoral artery. Now the femoral artery descends down through the apex of femoral triangle into the adductor canal. Through the adductor canal it goes to leave the adductor canal through the fifth osteoaponeurotic opening in adductor magnus to enter into popliteal fossa. Now what do I call it? Shall I continue to call it femoral artery? No, I will call it popliteal artery. External iliac, femoral, popliteal, same arteries. Okay? As per the region, they are getting variably labeled. Right. So let's talk about what it does in the femoral triangle. You saw that it entered the femoral triangle deep to inguinal ligament at a point called midinguinal point. Question: what is midinguinal point? It's the midpoint of a line drawn from anterior superior iliac spine to pubic symphysis. It traverses the triangle now. Where does it leave the triangle? At the apex, here. Okay. So what does it do in the triangle? What is it related to? It's related to laterally. Look at the image, see if you can answer yourself. At the base of femoral triangle, it is related laterally to perfect femoral nerve, medially to femoral vein, posteriorly to nerve to pectineus and then the pectineus muscle itself, and anteriorly it's related to the femoral branch of genitofemoral nerve. Okay. All the proximal end of the femoral artery along with vein is enclosed by a femoral sheath. So it has entered inside the triangle, it's covered by inguinal ligament, it has traversed it, laterally related to femoral nerve, medially femoral vein, and so on. Get your artery in place in your mind. Right. At this point, I will be able to feel the pulsations of femoral artery by pressing it at the midinguinal point against the superior ramus of pubic bone. This is a question I want you to think about and get back to me. Right. Now, important relations to be remembered at the apex now. See, there's a hand there. I want you to put your hand in that manner. I'll tell you why. As it reaches the apex, it is laterally related to the saphenous nerve, crossed from lateral to medial side by the medial femoral cutaneous nerve and posteriorly related to femoral vein and adductor longus muscle. Now, take that hand, the middle finger is the artery and the index finger is the vein. See how they cross. At the base, the artery is lateral, vein is medial. At the apex, artery is anterior, vein is posterior. Got it? Use this to remember. Correct. So now, what is the femoral artery used for in the triangle? It is used for cannulation. See, it's very easy to approach. It's there, superficial. So, you can cannulate it, carrying the cannula, the catheter up from femoral, external iliac, common iliac, right to the aorta. You can inject a dye in any artery and delineate its branching pattern. Same can be done in coronary arteries. You can see where there is a blockage in the coronary artery, and this procedure is called as angiography. Okay, so that's one of the uses of the femoral artery. Oh wow, this is interesting, isn't it? Suddenly, oh wow. Yes, this is because the femoral artery is so superficial here in the groin region that it is very prone to penetrating injuries, causing massive hemorrhage, which is what is happening in this case. This is an urgently requiring treatment case, okay? You have to be very prompt in responding to such massive femoral artery injuries. Right. So having done the femoral artery, discussion in the femoral triangle, let's talk about the branches it gives out in the triangle. It gives out the following branches: superficial circumflex iliac, superficial epigastric, superficial external pudendal, deep external pudendal, profunda femoris, and muscular branches. These are in the femoral triangle itself. Let's learn a little bit about each of them. I want you to draw this diagram to understand, okay? I want you to draw the anterior superior iliac spine and the pubic tubercle. Take a green colored pen and join these two to draw your inguinal ligament. Now let's draw the femoral artery. As you're aware, it enters into the femoral triangle at the midinguinal point. So here is your femoral artery. It gives rise to a superficial circumflex iliac artery, a superficial epigastric artery, a superficial external pudendal artery, a deep external pudendal artery, the profunda femoris, which is its largest branch, and a number of muscular branches. Just remember, the profunda femoris gives rise to two important branches, the lateral and medial circumflex branches. Okay, now let's do the job of coloring all this. So that's my femoral artery, profunda femoris, deep external pudendal, superficial external pudendal, superficial epigastric, and superficial circumflex iliac. The two branches of profunda, medial and lateral, can also be colored, medial and lateral circumflex, and that, my dear students, is the drawing of femoral artery. Let's take it further. Let us learn a little bit about each of these arteries now. As you can see, the superficial circumflex iliac is moving towards the anterior superior iliac spine. Here it meets the ascending branch of lateral circumflex femoral artery, the branch of superior gluteal artery, a branch of iliolumbar artery, and a branch of deep circumflex artery. These arteries meet at anterior superior iliac spine, forming what is called as spinous anastomosis. See if you can remember it, otherwise it does not come under Shurno category. If you can remember, fine. Right. Let's now talk about the other arteries. Superficial epigastric supplies your lower abdominal wall. Superficial external pudendal and deep external pudendal are separated by the spermatic cord, if you can see. They are going to supply blood to the scrotum or to the labium majus. Now here we can see the profunda femoris artery given off about 3.5 centimeter below the inguinal ligament. The profunda femoris is the largest branch of femoral artery, and it gives rise to two important branches before it leaves the triangle to go posteriorly. The two important branches are lateral circumflex femoral artery and medial circumflex femoral artery. Now what happens to profunda, madam? Where does it go? You can see that it disappears posteriorly, passing between the pectineus and adductor longus, which are part of the floor of femoral triangle. So it passes between them. Then it passes between adductor brevis and then passes towards the adductor magnus. Okay. As it reaches adductor magnus, it gives rise to branches which are called as perforating arteries. Can you see those small branches there? Perforating arteries are labeled as first, second, third, fourth perforating arteries. Fourth is the profunda femoris artery itself. These arteries now divide into ascending and descending branches, forming an anastomotic arcade along the attachment of adductor magnus. You can see the anastomotic arcade there. The first perforating artery passes upwards. The ascending branch ascends upwards to participate in what is called as cruciate anastomosis. Okay, students, I'll tell you how to remember all this. At this moment, just put it in your brain. Cruciate anastomosis. So, what have we learned? This is a question for you. Which artery gives rise to the nutrient artery of femur? Find out and give me the answer. Right. So, now what have we done? We saw the femoral artery in the triangle. We gave rise to a number of branches. We discussed each of those branches. We saw how it participates in spinous anastomosis. Then we discussed profunda femoris, leaving the triangle going posteriorly, giving rise to 4 perforating branches. Before it gave rise to these branches, it gave rise to 2 important arteries, lateral circumflex femoral and medial circumflex femoral. Got it up till here? Just remember the profunda lies very close to the shaft of femur and might be damaged in case of fracture or in case of any manipulation for healing of the fracture of femur. Right. So let's talk about the lateral circumflex femoral artery. Here you can see the lateral circumflex artery dividing into ascending branch that participates in spinous anastomosis. It gives rise to a transverse branch and a descending branch. Descending goes towards the knee. The transverse branch goes towards the greater trochanter of femur. I'll tell you what it does there. The medial circumflex femoral artery is given off by profunda. It is moving posteriorly, giving rise to a very important acetabular branch. Anybody knows why acetabular is important? Yes, it's that branch that passes through ligamentum teres femoris to supply the head of femur. If this artery is damaged, head of femur undergoes avascular necrosis. Remember this, it's very important blood supply. It also gives rise to 2 more branches, ascending and transverse. We'll see what these branches do soon. Right. Now this is a very busy image, isn't it? I can see hip bone, I can see femur, I can see a lot of blood vessels here. What I can see is this is my medial circumflex femoral artery and this is my lateral circumflex femoral artery. And they seem to be participating in a number of anastomosis around the greater trochanter of femur. This is an enlarged image of the same. This is medial circumflex, lateral circumflex. You can see it participating in a plexus at the base of greater trochanter called as cruciate anastomosis. Another plexus at the greater trochanter called as trochanteric anastomosis. Okay. Now let's come to an important part of today's class, understanding how to remember this. This is all only a lot of nerves, blood vessels. How are you going to remember it? I'll tell you how to remember it. Come on. Take your notebook and begin to write the following arteries. Medial circumflex artery, lateral circumflex artery, first perforating artery, inferior and superior gluteal. Okay. Now let the medial and lateral circumflex give rise to transverse branches towards each other. First perforating gives rise to an ascending branch. You remember we discussed this a minute back. And inferior gluteal gives rise to a descending branch. These arteries which come together at the base of trochanter are called as the cruciate anastomosis. Similarly, the medial and lateral circumflex arteries ascend upwards They meet with the transverse branch of inferior gluteal and a descending branch of superior gluteal, forming an anastomosis called trochanteric anastomosis. So, trochanteric is formed by 2 gluteal and 2 circumflex. Cruciate is formed by 2 circumflex, 1 gluteal and 1 first perforating artery. See, if you practice, you will be able to remember this very easily. This is just for you to see. I will not discuss it. The artery now enters into the adductor canal. Traversing the adductor canal, in accompaniment of the femoral vein, crossed from lateral to medial side by the saphenous nerve. The artery leaves through the 5th osteoaponeurotic opening to enter into the popliteal fossa. So, in the adductor canal, it gives rise to one artery. Which one? Descending genicular artery. The descending genicular gives rise to a saphenous artery which accompanies the saphenous nerve at the medial aspect of the knee. Rest of descending genicular also goes to the knee to participate in an anastomosis there. There is a point I am making, students. I am not having some sadistic pleasure out of giving you all these anastomoses. We are making a point here. See that every artery I have shown you is going towards the knee, creating anastomosis around the knee. Why do we see so many anastomoses around the hip and the knee joint? That is my question. I'm not expecting you to remember all these details. So, this is done to counter the effect of movement and stress or potential disruptions. So, as you're moving, these arteries, some artery or the other is going to get compressed. So, because there's an anastomosis, the tissue damage and loss of function is avoided. That is why the lower limb, which keeps you moving, has been provided with so many anastomoses. Remember this? Let's move on. How shall I draw my femoral artery in a surface marking? Have the patient lie down with the slightly flexed, laterally rotated, abducted leg. Slightly flexed, laterally rotated, abducted leg. Draw the midinguinal point. Go to the adductor tubercle. Join the two. The upper 2/3 of this is your femoral artery. Mark it. That's how you do your surface marking. So let's talk about some applied aspects. How shall I arrest a bleeding from femoral artery? You will compress the femoral artery at the midinguinal point against the head of femur or superior ramus of pubis. Let's talk about a condition called intermittent claudication. What is this? What happens sometimes is arteries can get clogged, atherosclerosis. This causes arterial occlusion. Now look at this guy, he's out there going for a walk. As he walks, he begins to have severe pain in the calf. And he's tired, he feels he can't take it. So he sits down. Can you see him sitting down here? As he sits, the muscle cramp gets relieved and he can begin to walk again. This situation is called as intermittent claudication. It is a cramp-like pain felt in the calf muscles on exercise, relieved on rest. Please remember this when you go to your surgery years, you are expected to know this, So I've just given you a little knowledge beforehand. Right. Placement of arterial line in femoral artery. Now, normally arterial lines are placed so that you can collect blood samples without having to prick the patient repeatedly, and you can have arterial blood gases measurements and so on. Usually this is placed in the radial artery most commonly, but sometimes in an emergency patient you might put it in the femoral artery, which is the next preferred location for placement of arterial lines. This is easy because then it has a wider diameter, quick access. Let's revise the femoral artery, students. We've studied the arterial diagram. We understood from heart how blood begins to come down through external iliac into your lower limb as femoral artery. When we did the course of femoral artery in the thigh region till it became the popliteal artery. Then we discussed the artery in the femoral triangle with its relations. We discussed how to feel pulsations of femoral artery. We discussed how it is damaged so easily in the thigh and what to do about it. How it's used in arteriography. Then we went on to talk about the branches of femoral artery. Okay, we discussed each of the branches. I also showed you how to draw the femoral artery, which is very easy. You saw that. Then we discussed each branch. We talked about Profunda femoris, lateral medial circumflex, and then went on to talk about the anastomosis. Which anastomosis? Spinous anastomosis, cruciate, trochanteric. We drew the cruciate and trochanteric anastomosis. Please do it again so that this knowledge becomes permanent memory for you. Then we talked about its course in adductor canal and finally surface marking and applied anatomy. This is a fabulous way. Just look at this screen and quickly revise your femoral artery. You will not have missed out much. Okay. We talked about intermittent claudication. I want you to remember that. Surprise your examiner with some extra knowledge. Okay. Right. So let's solve some MCQs and see if you have understood this. I'm confident that you will be able to solve all these MCQs if you have been listening to this class carefully. Okay. With this, I end my class on femoral artery. I hope you enjoyed yourself. I hope you learned something. It's a very important artery. Remember, no artery, no limb. So you have to know your artery well. Otherwise, you are likely to make your patient lose the limb. Study well. There's a responsibility comes with doing medicine. Okay? Right. Education is the passport to the future. For tomorrow belongs to those who prepare for it today. Thank you, students. I had a great time teaching this very important class. I hope you learned a lot today. Thanks. See you across the screen in some other video.